you can see is a simple injection, isn't it? How many of you are fine with application of this syringe? Of course, not on the patients, but yourself. I guess very few, perhaps no one. Imagine you applying the very same syringe on yourself every day for your entire life. Not a wonderful scenario to be part of, neither a pleasant experience to feel. Before proceeding to my topic, it is very important to know why is oral complication of diabetes so important to know. First, dentists, they play an important role in the diagnosis of diabetes by referring the patient to physicians and investigating them. Secondly, the physician itself play a very important role in coordinated management with the dentist and other colleagues. And lastly, for the patient himself, awareness of the condition for the patient is very essential and very crucial. He must be aware of the condition that he is suffering from and how are these conditions being managed and treated. So, moving on to our topic, diabetes is simply defined as a chronic metabolic disorder. The International Diabetes Federation estimates that 285 million people around the world have diabetes, something really important to worry about. The complications of diabetes are widely known, two very important complications, microvascular and macrovascular complications. The oral complication is not of much difference, but a combination of both these complications that lead to impaired white blood cell function, decreased collagen synthesis, increased collagen degradation, and finally leads to oral complications. The oral complications include periodontitis, gingivitis, taste infection, candidiasis, lichen planus, and so on, but are not certainly limited to only these conditions listed over here, but include many more conditions like periopic collapses, loss of teeth, impaired ability to wear dental prosthesis, burning mouth syndrome, and etc. Gingivitis, simply defined as inflammation of the gingiva, and periodontitis is inflammation of any of these four structures that supports the tooth. The severity and frequency of periodontitis is significantly increased and higher in patients with diabetes than normal people. It is also referred to as the sixth complication of diabetes mellitus. Now, this is something for my fellow colleagues and for the physicians that previously it was believed that diabetes can lead to periodontitis, but now there are studies and evidence that shows periodontitis can lead to diabetes. There has been numerous studies and they are being accepted widely. They are both referred to as a two-way sword and they have a bidirectional relationship between them. So it is very important to know how this periodontitis looks like and what can be done to treat that condition. And this is how periodontitis looks like. As you can clearly see, the roots of the front central incisor are clearly visible, the others as well, and there is gingival recession, there will be increased mobility of the tooth, and on your right side you can see there is alveolar bone loss that leads to tooth mobility and loss of teeth. We all know that gingivitis and periodontitis is caused by diabetes, but how? There has been numerous studies which shows that there is interaction between dental plaque and other pathological findings like increased number of AGE products, salivary hyperglycemia, and impaired white blood cell function. Xerostomia, often known as dry mouth. Polyuria is one of the common symptoms of diabetes, and it is believed that xerostomia is caused because of that and because of alteration in the basement membranes of the salivary glands. It can lead to other conditions like burning mouth syndrome, altered taste sensation, and dental caries. Here is a patient with salivary hypofunction. He is also suffering from dental caries, you can clearly see, and xerostomia. Here again, a very dry tongue, inflamed, red, and this patient was suffering from xerostomia. Taste is a very critical component of a human body. What will be the life of a patient if he cannot distinguish between a salt and sweet sensation? but the relevance in our topic for today will be that it inhibits the ability to maintain a proper diet and can lead to poor glycemic regulation and obesity. It is believed that because of the neuropathies and xerostomia happening in the diabetes, taste disturbance is because of that. Burning mouth syndrome is the feeling of burning sensation and pain inside the oral cavity. Even when there is no detectable lesion, the causes may be multifactorial, like neuropathies in the oral region, candida infection, and xerostomia. Here on the right side you can see prominent taste buds, and this patient was suffering from burning mouth syndrome. Candidiasis. Candida is the normal flora of the oral cavity. If there is a slight imbalance between this normal flora, candidiasis is the result. So candidiasis is caused because of chronic immunosuppression, and diabetes we know that leads to chronic immunosuppression. This is how candidiasis looks like. Lichen planus is a chronic mucocutaneous disorder. About 25% of patients suffering from diabetes are being recorded to have lichen planus, and the cause is metabolic abnormality of diabetes, may be the cause related to immunopathogenesis of lichen planus. This is how lichen planus will look like. And it can cause acute oral infections like periodontal abscess, palatal ulcer, recurrent bouts of herpes simplex virus. But one important thing to know is that etiology of all the oral conditions that I mentioned before is very, very important. Every one of you sitting over here will know what to have when you have a headache, but very few will know why am I getting a headache and why is the other patient getting a headache. So etiology, definitely management and treating the condition is also very important, but on the physician and dentist part, etiology should be addressed first. In the conclusion, I would like to say that oral complication is a very common in diabetic patients, and to recognize this condition in earlier stages, to manage this condition properly, and to detect this condition is very, very essential in order to prevent further complication caused by this condition. Today, I'll leave you with something to think about. What's better, brushing 2 times a day or need of extensive treatment, dental treatment? Maintaining a proper glycemic control or using salivary substitute forever to treat your diseases? Exercising daily or injecting yourself daily with insulin for survival? This is also a kind of exercise but not a healthy one. The choice is yours. Thank you for your listening and time.